Welcome to this recap and summary of the MSc Policy and Practice module. Essentially what I want to do is to summarise the main themes from the module, try and go over some of the main aspects of the module content, and also it would be quite useful for me to try and bring these themes together, particularly at this point in time as you're focusing on the improvement projects that you have for the module, and obviously you'll be putting the finishing touches to that over the coming week, and I would like to take the opportunity to just mention some things just to think about as you're completing the project. Okay, so when we started the module, we came at this module thinking about the applied nature of public policy, and the reason why we're studying policy and practice at this level is for a couple of reasons. One is to get our heads into the realities and analytical challenges associated with understanding public policy and the role of civil society bodies in the creation of and implementation of policy. However, when we started the module, we really came at it from a slightly more conceptual perspective. As often you do in modules, you'll often start with some kind of conceptual and theoretical grounding to your studies. And that's what we did with this module. We tried to understand some of the perceptions on policy analysis. And when we're talking about policy analysis, really what we're trying to do is understand the factors, drivers, and actors that are involved in the creation of public policy, the implementation of public policy, and in the evaluation of it. It's not just that, however, it's try to understand power dynamics as well, and to understand the landscape upon which policy making takes place. And as academics, as students, one of the things that the challenges for us is to understand the complexity of that environment, to understand the role of different actors within that context. And that's what you've been doing when thinking through the role of your own chosen civil society organisation and thinking through the contribution that civil society body has made and is currently making to public policy and public affairs. Now, there's a range of different ways to study policy analysis, and we undertook analysing some of those dimensions, thinking through how you undertake a rational approach to policy making, how you understand policy making in terms of whether it's more of a kind of disjointed or incremental process, but also understanding the notions of complexity that underpin policy making. And one of the words that often came up in that discussion was complexity. Understanding complexity is something that analysts have to do, and as you move on in your careers, whether it is in the public sector, the third sector, or even the private sector, there will be aspects of your role which try and get you to come to terms and get to grips with complexity and the role of a range of stakeholders in the policy process and the policy area that affects your organisation. But how do we understand this? How do we understand the complex nature of the environment in which we work? Well, systems perspectives is something that is quite useful for us to consider when thinking through the environment and the stakeholders upon which are involved in your area of public policy. When we think about systems, it comes from almost a kind of more industrial, private sector orientated understanding of how things operate, and that one part of the system has implications for another. Well, it's quite like that in public policy, and some of the ways that we describe that is through notions of governance. there's different ways to understand this word governance, and we've talked about multi-level governance in the module. But governance really refers to this kind of more systems orientated perspective of public policy and the range of ways in which different ideas, actors, groups, networks operate, come together to basically make up this system. So really what we're trying to do is navigate that system and understand the contributions that civil society bodies make to public policy. Now, one of the notions that we came up with was the idea of policy subsystems. Now, policy subsystems is something that would affect your policy area specifically, and that it would allow you to look at your policy area and look beyond that to say, well, what are the kind of key actors and drivers that are affecting this policy area? So if it's health policy, for example, is the subsystem for health policy different to that of, say, agricultural policy or for economic policy, for example? Yes, it's often the case that different policy areas have different actors that surround them. And that's why policy and understanding policy it often has to take place within a kind of case study led approach, because it wouldn't be correct to say that all actors are involved in the same way across different policy domains, or that power dynamics are the same across all areas of public policy. So this is really why it's important to focus on your case study and branch out to understand the range of power dynamics and actors that are involved in affecting your policy area. So systems perspectives are very useful in thinking through complexity at that kind of more micro level around a public policy area. Another theme that we looked at was the idea of, or the challenges even, evidence and public policy. We looked at the ways in which there sometimes can be a troubled marriage or a troubled relationship between evidence and public policy, because there's actually quite a lot of debates about what actually constitutes evidence. So, for example, is evidence the result of sophisticated evidence gathering approaches like randomised controlled trials or complex survey methodologies, or high level approaches to qualitative research, or a combination of those? Well, of course, that's data, but one of the things that we discovered was evidence might be articulated and described by policymakers in a range of different ways. For example, what about the role of anecdotal evidence? What about the role of knowledge, experience of public sector bodies, civil society bodies, individuals? So how do we actually manage those evidence sources? And how do we bring those things together? That's a challenge for public policy in itself, understanding what evidence actually is. But even so, what about the relationship between evidence, and we'll put that in inverted commas, and public policy decision making? Now, there are a range of reasons why evidence might be just one part of the policy making pie, and that is because we cannot remove the fact that policymakers have a range of different drivers, issues and considerations when it comes to moving public policy forward. So, for example, does the role of political ideas trump what the evidence might tell you? Or are certain policymakers more prepared to take an evidence-based approach over others? An example that we looked at in the module was the introduction of minimum unit price for alcohol, whereby the Scottish Government has taken a rather different approach to the UK Government on this issue. And what we can say is that the Scottish Government have tended to take more of an evidence-based approach in many ways, but looking at that evidence-based approach in terms of the impact of alcohol on health and well-being in Scottish society. Whereas the UK Government have all have regarded the introduction of a minimum unit price for alcohol as a challenge to liberty in some respects, and it's too much of an interventionist approach to public policy, and the policy itself would affect moderate drinkers. So they actually felt that the evidence on the financial impact on moderate drinkers was more important for their political agenda than, say, for Scotland. So you could argue that perhaps they're both taking an evidence-based approach in some respects, but what it comes down to is the impact of the political idea in suggesting what evidence should feature. So we cannot remove the role of agendas, ideologies in this discussion about the relationship between evidence and public policy. There's a range of different ways in which your civil society organisation might actually seek to impact on the policy process by providing evidence. Quite often, the civil society bodies that we've looked at in the module will actually formulate their own research, generate their own evidence, and they will want policymakers to listen to that. But quite often, the extent to which that evidence is listened to by government will depend on the level of maturity in the relationship between those civil society bodies and policymakers. And this really gets to the point of the extent to which your civil society organisation actually has insider status in the policy process, or whether it actually has more outsider status. Wyn Grant talks about this when he refers to the role of pressure groups and interest organisations in the policy process, i.e. the extent to which a group is an insider or an outsider group. Those insider groups have access to policymakers, access to the corridors of power, and attend meetings and have that opportunity to get their word across and have that influence. But it might be that some civil society bodies just don't have that level of a mature relationship with policymakers, which might make it difficult for them to influence the policy agenda. And that's something that it would be important for you to reflect on when doing your improvement projects, when you're thinking about the success and failure of the civil society body of your choice and influencing the political and policy agenda. Well, we need to actually think about where the position, the institutional position of your civil society body. Is it on the outside? Is it on the inside? Is it somewhere in the middle? So it's something to reflect on when undertaking your projects. Another aspect we focused on was the idea of evaluation. Now, one of the things that's quite important in the Scottish public sector in recent times, particularly in terms of public sector reform, is the move to more of an outcomes approach to public sector delivery and evaluation. This has really been generated as a result of the Scottish Government's approach to public sector reform, particularly with regards to things like the National Performance Framework, which sets out a series of pillars and outcomes for civil society and the public sector to work towards when it comes to the delivery of public services. And those outcomes might include things like reductions in harm through health inequalities, reductions in health inequalities. It might also refer to reductions in crimes rates. It could relate to increased economic prosperity. So a range of those different drivers, or if you like, or outcomes, are affecting the ways in which the public sector needs to operate. So there are drivers in many respects. But the issue here, when we think about outcomes, is what you're trying to do is demonstrate impact on change, because outcomes represent change. So if you're trying to reduce health inequalities, for example, what are the ways in which you're going to do that? And are the civil society bodies, public sector bodies, geared up and equipped to do that? Do they have the skills, the knowledge, the resources, the time, the space to deliver and to actually demonstrate the impact of what they do? There have been some moves in the public sector to think about this. For example, organisations like NHS Health Scotland, Education Scotland, Healthcare Improvement Scotland, and we had representatives from Healthcare Improvement Scotland and Health Scotland in the videos on the Moodle site as part of the module early on. And one of the themes that they drew on was this idea of outcomes and how you actually do that, how you actually gear your organisation up to demonstrate impact, and how do you actually do that. It's challenging, there's no doubt it's challenging, but there are methodologies and approaches that can help us in this endeavour, and we talked about this in terms of outcomes-based approaches to evaluation. We talked about the idea of contribution analysis and participative approaches to planning, implementation and evaluation. And what we said was that in the public sector, one of the things that the Scottish Government has tried to encourage, and a range of public sector bodies have tried to do with varying success, is to take a participative approach to policy, planning and evaluation. Now, this basically means involving stakeholders in the formulation of policy from the outset, but not just that. Use the same group of stakeholders to help you monitor and tell a story about the impact of public policy. So this idea of participation basically means that a range of stakeholders have an interest in the policy area, but also they have a responsibility as well, by virtue of that relationship, to work with each other to help demonstrate impact against outcomes. However, that may sound very nice and very ambitious in some respects, and it is ambitious because there are a range of factors associated with this. For example, although we understand participation as something that might be quite good, to listen to different people's perspectives and to involve different agencies, organisations, stakeholders in the policy process, there are challenges with this because we cannot assume that this leads to no power dynamics, or it means that it's a nice equal relationship amongst partners when it comes to formulating policy. For example, we need to remember that a key actor within that process will often be the funder, say the Scottish Government, for example, which funds civil society bodies. Not every civil society body, but they'll often fund civil society bodies, and that relationship as the funder will bind that organisation in some respects. It will not allow the organisation to have complete free rein in deciding what it wants to do in terms of its level of participation, what it might say when it comes to the formulation of policy. So there are a range of dynamics within this idea of participation that we need to be mindful of. We cannot suggest that there's a nice equal relationship between partners when it comes to involving themselves in a participative process. And we reflected on the fact that, say, for example, organisations like NHS Health Scotland. We listened to the video by Andrew Fraser on the module, and Andrew Fraser, as the Director of Public Health Science within the NHS Health Scotland, he has relationships with civil servants. He's got to work with civil servants on a daily basis in Scottish Government. But the institutional position of that organisation is quite complex because it's quasi-autonomous. It's not completely autonomous. It's not independent from government. It's semi-independent from government, which basically means that that relationship almost binds that organisation in some respects, or reins it in perhaps slightly more than it would have liked. So in terms of the institutional position of an organisation like NHS Health Scotland, what they've got to consider is the extent to which they have free rein to suggest and do and take an innovative or autonomous approach to, say, trying to influence the policy process. As an evidence-generating organisation, they often want independence when it comes to generating evidence. Say, for example, on issues to do with what policymakers should do to deal with health problems in society or reduce health inequalities. And quite often what you'll find is that relationship isn't a purist one, because there is an element of being accountable to Scottish ministers, and the fact that Scottish civil servants might actually have a different views on how things should be done. So that can lead to tensions, and it can lead to issues. However, so basically what we're saying is, it depends on your institutional position, it depends on the power dynamics within subsystems and among stakeholders with regards to the extent to which you can influence public affairs and public policy. One of the themes we drew on, and we've kind of discussed that to an extent up to this point, is the kind of what we call the real world of public policy, the kind of more applied insights. And myself, as a former policy and evaluation advisor with NHS Health Scotland, I tried to bring in some of the insights from my own area in terms of the nature of the work that I was doing and the relationships that I had with, say, different organisations and bodies such as territorial health boards, the third sector, and Scottish Government. And one of the things that we've discovered is that trust is very important. Trust is a very important thing in establishing relationships with partners and being able to rely on each other, be able to support each other in the endeavour of, say, evaluating a policy. Relationships are very important, and as a policy and evaluation person, or if that's the kind of nature of the role that you'll be undertaking in your careers, we can't forget the importance of softer skills that are important for your role. So it's important, obviously, to have a good knowledge of, say, public policy, a good knowledge of research methodologies, evaluation approaches, of course, because that's kind of like your bread and butter issues and things that you have to think about from a more competency point of view. But in terms of employability, and this was reflected upon in the videos that we had from stakeholders in civil society on the module site, is the importance of those softer skills. So, for example, your ability to negotiate, your ability to build relationships, your ability to demonstrate how you can actually be a team player when it comes to working with a range of partners. Those skills are just as important as being competent on, say, research methodologies. So there's something to think about, and the advice that we got from stakeholders in the videos was, get some experience, work with partners. Work experience is very important, and actually supporting your personal awareness, your negotiating skills, your communication skills, these things are all very useful when it comes to thinking through how you actually apply these when it comes to the job market. We also looked at, and this is an important theme, particularly for your improvement projects, is understanding and establishing policy success, failure, or grey areas. We looked at the literature, the fairly recent literature on this, particularly by Marsh and McConnell, who reflected on the fact that quite often what you'd find in public policy research is lots of writing on, implementation, policy formulation, decision making, those types of themes, but less attention had been paid to how you actually establish whether something has been successful, or if something's been a failure, or if something kind of sits in the middle somewhere. And what they try to do is establish a number of dimensions of success that are accompanied by indicators that might give us the best guess, or a plausible guess, as to the extent to which there has been success or failure. Now, I say plausible because the notion of success and failure, although it hasn't been researched heavily in the literature, those that do look at this issue have suggested that it's a very subjective notion, the idea of establishing success. So if 80% of school pupils get an A in their higher exams, is that a success? Is 95% a success? Is 80% a failure? How do we make that judgment? What criteria will we use? So there is an element of subjectivity associated with establishing policy success. But of course we have to think about what the original objectives were of the policy area in the first place, in order to have some kind of benchmark or some kind of criteria upon which success or failure will be judged. So I would encourage you to reflect on some of that writing from Marsh and McConnell. Think about the range of different dimensions that they establish when it comes to looking at the issue of success. They say that you can have success at a political level, but maybe not so at a programmatic level. Or you could have success at a programmatic level, or maybe a more process orientated level. There hasn't been such a high degree of success, and they've established different indicators for those different levels. So basically what we're saying is there are dynamics of success within this topic, and it would be interesting for you to try and unpick some of that in your own areas, and also when it comes to perhaps when you actually move on post university to the job market, is to reflect when you're undertaking improvement projects with a range of bodies, to think about how are we establishing success here? What is the criteria upon which we are going to assess whether something has been a success or failure? We also looked at an analysis of substantive policy areas, and we drew on the substantive area of health policy related to inequalities, and this is very much a research-led approach because we drew on the evaluation activity that myself and colleagues, when I was working in Health Scotland, were involved in, particularly around trying to demonstrate the impact of an intervention. And we looked at the idea of the national programme called Keep Well, which is a targeted health check programme within deprived areas that was rolled out across Scotland after 2007, and different local health boards took different approaches to the implementation of the intervention, and the challenge was to actually establish whether the policy on the introduction of Keep Well as an anticipatory care programme was successful or otherwise. And we talked about the pragmatic nature of evaluation, the team-based approach to an evaluation approach, and what we were able to say about whether success had been there or not. And one of the conclusions of the evaluation, of course, was that according to the Scottish Government's criteria, the programme had not been particularly successful. Their criteria being reductions in cardiovascular related morbidity and mortality in Scotland being reduced, reductions in health inequalities. The programme didn't demonstrate evidence to suggest that it had done those things. But in the process of taking a participative approach to evaluation, what we discovered was that different health boards tailored the programme to suit their own context, and they actually didn't necessarily suggest all of the time that reductions in cardiovascular disease were the most important outcomes for them. In some health board areas, there were the emphasis, if you like, on the outcomes relating to trust building, how you actually get patients to take more control over their health, how the intervention can be a vehicle by which you engage with people who live in deprived communities and actually introduce them to the health service. So is the fact that the government's criteria for success, is the fact that they weren't particularly found to be successful as a result of the evaluation, does that mean that the programme should never have been introduced in the first place? Given the fact that different local health board areas suggest that there's evidence that it can be, as an intervention, a really good anchor to get people to engage with the health service. So there's different ways in which you might want to judge success and failure within that policy area, but it also gives us some lessons about how pragmatic approaches to evaluation are important, often necessary given resource constraints. And another theme that we looked at in the module is the impact of multi-level policy drivers and dynamics, particularly looking at the role of local government. And we looked at the impact of historical legacies on how we understand local authorities and government. And we looked at the impact of previous reforms to local government and how they have set a path, if you like, for future reforms. And when we talk about that in policy analysis, we refer to that as path dependence, the extent to which previous institutional structures have an impact on what comes next. And I think that's particularly the case with Scottish local government, and Michael Pugh took you through some of those issues. But coupled with that is the fact that there's a number of international policy drivers which have direct effects on local government, because local government being the street level actor in many ways, the kind of ultimate implementer of public policy from an institutional point of view. And you can look at things like the impact of the global financial crisis post 2008, and look at how the impact of that has really trickled down all the way to Scottish local government in terms of austerity, the impact on inequalities, the issues that local government are having to deal with partners, civil society partners, as part of that process. So there's a range of different ways in which a range of historical, international issues have had an impact on local government from a multi-level perspective. But not just that. Reflecting on what we talked about earlier, if we think about the outcomes approaches to public sector reform, the dynamics of public sector reform, particularly in terms of issues to do with sharing of services, joined up approaches to government, all of those different things directly affect local government. So these are the factors that are quite important when thinking through the role of your civil society body. To what extent are they involved in that level of governance? Are they part of public sector reform? What's their role within that? Do they have an interest in it? We also looked at Professor Robert Piper looked at the idea of the role of professional advice and that input to the policy process. Also reflecting on the nature of the bureaucracy, if you like, the civil service, and the extent to which they are prepared to listen to advice, the extent to which it's easy to get advice onto the agenda within the bureaucracy, and the extent to which bureaucrats, officials, ministers are actually prepared to listen to that advice, and who gives the advice. So there's a range of different factors and dynamics associated with that, and that really gets us to think about the role of your professional, or your civil society body in the provision of professional advice, because quite often trade unions, interest groups, think tanks, these different civil society organisations might want to have relationships with the bureaucracy. Does your civil society body have that? So try and reflect on some of that when it comes to your improvement projects. In terms of thinking through some future challenges, the current research on policy and practice, particularly in Scotland, has an interest going forward in a number of different things, and this relates to the nature of public sector reform. It relates to new legislation that's came onto the statute books in Scotland, and kind of wider drivers in terms of austerity. And one of the things that would be interesting from a more kind of project management or programme management perspective, which will be interesting for you to think about, and a challenge potentially when you go onto the job market, is to think about this idea of co-production. So how do you actually involve the beneficiaries of public services in the design of those services at a number of different levels? So it could be locally, within the community, at a national level. How do you do that? How do you co-produce? What are the methods upon which you can co-produce public services? And what are the challenges associated with that? Is co-production actually possible? Because is it the case that only those that have the ability to have their voice heard, have the resources to have their voice heard, be participants in a co-productive process? Are there inequalities in that relationship? These issues are also very acute when it comes to issues to do with empowerment. Empowerment is something that's gathered quite a lot of momentum recently. Across the UK, the Welsh Government are looking at how to empower communities. At the moment, there's a white paper that's been published by the Welsh Government on thinking about how you empower local people to get involved in the design and implementation of services. We've got the Localism Act 2011 in England, which really emerged as a result of this idea of the so-called big society. And also in Scotland, what we've got is the draft bill on the Community Empowerment Bill, which is really trying to get local authorities to think about how to involve citizens and empower citizens in the formulation of local services. Is empowerment something that can be done? Is it something that is guided by particular views of empowerment, particular actors, powerful actors defining what empowerment is? How do you get to the hard to reach groups in society? How do we empower those actors? How do we empower those citizens? So these are real issues, current issues, challenging issues that we might want to think about when it comes to policy and practice. Austerity is something to think about as well, because obviously what we have now, since the May election recently, is the re-election of a Conservative government that's committed to further austerity in many ways. And what impact will that have on civil society bodies, the funding for civil society bodies, their ability to actually have their voice heard in civil society? So there's a range of issues going forward, very current issues that are useful for us to think about going forward as researchers in policy and practice. When it comes to your improvement projects, just a few final words on that. Throughout this podcast, I've been trying to basically identify a number of themes to think about when it comes to putting the finishing touches to your improvement projects. Those things are understanding the context of the organisation that you are focusing on, particularly from a systems perspective. Who are the stakeholders that are involved in that civil society body? Who are the most powerful actors in shaping what that civil society organisation does? Does the civil society body have insider status to the policy process, or are they acting more on the outside or in the fringes? Why is that the case? Does austerity have an impact on the ability of the civil society body to demonstrate the impact of what they do? To what extent are they involved in providing evidence to the policy process? Do they provide advice to the bureaucracy? What is their relationship with the state? Is it a mature one? Is it an immature one? So it's these types of themes that I would like to think about in many respects. What are the multi-level policy drivers that affect whether that civil society body can demonstrate impact in society, or to establish the extent to which they have been successful? What are the issues within that? Of course, those themes are important, but don't forget the more basic aspects like structure, consistent referencing to sources, appropriate referencing, consistency of your referencing style, drawing conclusions. It might be that your conclusions are that it's hard to draw conclusions because the nature of the issue is so complex, and that is fine, as long as you're able to demonstrate in your main body of the piece as to why that complexity exists. Okay? So structure, consistency in terms of drawing on evidence, supporting your arguments with examples. These basic things are very important for your improvement project, so try not to forget those aspects when you're finalising your improvement projects. So these themes are what I would regard as the kind of main themes from the module. We did also look at employability aspects. We looked at this in terms of the first assignment, in terms of undertaking a mock recruitment process for a policy and advisor role, and some of the issues that might come up within that, some of the questions you might get by a panel, how you actually undertake the presentation stage of the recruitment process. So we're really trying to think about employability throughout this module, as well as some of the implied insights of project management and undertaking evaluation. I hope you've enjoyed the module, and of course please do get in touch with me if you would like to discuss anything at all associated with the module, and if you would like to discuss any of the themes further with me. Please do get in touch, and many thanks for your contribution on the module.